Neonates, particularly premature neonates, have a sort of unique moral position in the moral universe. In America, there are about 4 million babies born every year. About 10% of them, or 400,000, are born prematurely. That just means that it's defined as any baby born before 37 weeks of gestation. The kind of babies that, particularly neonatal ethics is mostly concerned with, are babies who are born under 2 pounds or under 1,000 grams. That's about 1% of all babies, or about 40,000 babies a year in America that are born at about under 1,000 grams. And they're the ones where the major sort of ethical decisions tend to arise. A lot of the decision making is about infants in cases that are more ambiguous, where the outcomes are potentially uncertain. If the baby survives, the baby might live 60 or 70 years. And if the baby lives 60 or 70 years, then the baby may or may not have some degree of impairment, whether the impairment is motor impairment like cerebral palsy or mental impairment like learning disability. All of those are possible outcomes, and the fact that we're uncertain about what the likelihood outcome is going to be, and that the parents are uncertain about what they want to do with that information, is part of what makes neonatal ethics so challenging. We value neonatal lives in a sort of unique way. We value them the way the parents would value them. And remember, these are not decisions like where should you send your kid to school, or should you get your kid fluoride in their toothpaste. These are decisions about whether or not the baby is going to try to live, or are we going to redirect care to palliative care. This idea that perhaps decision making before the baby's born is inherently imperfect and not the optimum way to do things. It might be better to, instead of generalize over a population of 100 babies or 1,000 babies, to individualize your decision making based upon a particular infant. That's the way we've been approaching the problem over the last 20 or 25 years.